and we're not out of the crisis yet. But now, vaccines are coming. Notre objectif est de fournir un vaccin sécuritaire et efficace aux Canadiens le plus tôt possible. Lors de la dernière rencontre avec les premiers ministres, le ministre Leblanc leur a parlé de la nécessité de travailler ensemble avec les provinces et territoires, ainsi qu'avec les communautés autochtones pour assurer le déploiement du vaccin. Il y a une semaine et demie, on a également annoncé la mise sur pied d'un Centre national des opérations par l'entremise de l'Agence de la santé publique qui est appuyé par les Forces armées canadiennes. Le major général Fortin dirige la coordination et la logistique et je sais qu'il possède le savoir-faire dont on a besoin. We are facing the largest immunization in the history of our country. This is no small task, which is why we have a clear plan. Our government, through the National Operations Centre, has been working with the provinces and territories to ensure that we're ready to roll out vaccine doses as soon as they're approved and delivered. On procurement of these vaccines, Minister Anand and her team have been working tirelessly to secure the most diverse portfolio of vaccines in the world, and today we see those efforts paying off. Canada has secured an agreement with Pfizer to begin early delivery of doses of their vaccine candidate. We are now contracted to receive up to 249,000 of our initial doses of Pfizer-BioNTech's COVID-19 vaccine in the month of December. Pending Health Canada approval, the first shipment of doses is tracking for delivery next week. Shipments will continue to arrive into 2021 with millions of doses on the way. This will move us forward on our whole timeline of vaccine rollout and is a positive development in getting Canadians protected as soon as possible. Pfizer, the Public Health Agency, and the provinces are working together to finalize preparations at the first 14 vaccination sites this week. I want to assure Canadians that any vaccine approved in Canada will be safe and effective. The regulatory process is ongoing and experts are working around the clock. They will uphold Canada's globally recognized gold standard for medical approvals. Le Canada a conclu une entente avec Pfizer pour commencer la livraison de doses de leur candidat vaccin plus tôt. Nous allons donc recevoir jusqu'à 249 000 doses initiales du vaccin de Pfizer-BioNTech au mois de décembre. Suite à une approbation de Santé Canada, les premières livraisons pourraient arriver la semaine prochaine avec des millions de doses prévues pour le début 2021. Cette nouvelle signifie que nous pourrons prendre de l'avance dans notre plan de vaccination. C'est un développement positif pour pouvoir protéger les Canadiens le plus tôt possible. L'Agence de la santé publique du Canada, les provinces et Pfizer travaillent ensemble cette semaine afin de finaliser les préparatifs pour les 14 sites de vaccination. Je veux en profiter pour réaffirmer que vous pouvez être certain que tout vaccin approuvé au Canada sera sûr et sécuritaire. Le processus réglementaire est en cours et les experts travaillent très fort. Le Canada est reconnu pour ses standards très élevés en termes d'approbation médicale et ce vaccin ne fera pas exception. Nous avons aussi des ententes avec 6 autres candidats vaccins, ce qui fait en sorte que notre gamme de vaccins potentiels est la plus large et diversifiée au monde. En plus de Pfizer-BioNTech, il y a aussi Moderna, AstraZeneca Oxford et Janssen qui ont déjà soumis leurs candidats vaccins à Santé Canada. Nous faisons tout ce qu'il faut pour nous assurer que les Canadiens aient accès à un vaccin sûr et sécuritaire le plus tôt possible, aussitôt que les doses seront prêtes. While vaccines are on the horizon, remember they cannot protect you if you get COVID-19 now. I know this winter will be hard, especially with the holidays fast approaching. but we're coming into the final miles of this crisis. So let's all buckle down and do what's necessary to keep ourselves and others safe. Over the last few days, we've seen new records of COVID-19 cases in a number of provinces. Hospitalizations are rising, families are losing people, and our most vulnerable are at risk. Just because we're getting closer to vaccines doesn't mean we can afford to become complacent. And on the other hand, just because the numbers are spiking doesn't mean we should give up in despair. Let's keep working together. And let's remember that together we will get through this. Parce qu'on se prépare à l'arrivée de vaccins sécuritaires et efficaces, il est important de maintenir tous nos autres efforts. Ce qu'il faut faire, c'est très clair. Assurez-vous de porter un masque, lavez-vous les mains, gardez vos distances et téléchargez et utilisez l'application Alerte COVID. Évitez les rassemblements et ne mettez pas votre santé ou celle d'autres à risque. Et ensemble, on va passer à travers. This morning, I also want to recognize that 50 years ago today, the report by the Royal Commission on the Status of Women in Canada was tabled in Parliament. When it was published, this report was a landmark document helping drive progress on gender equality. 50 years later, we've come a long way. But with this pandemic impacting women disproportionately, we're reminded that there is still much further to go. One of the most significant recommendations of the Royal Commission was to take action on childcare. Today, we are committed to moving forward with a universal childcare system. Our government will continue to take the steps needed to build and rebuild a fairer, more equal Canada for everyone. Today, I also want to recognize the news that National Chief Perry Bellegarde will not be running for another term. Perry has been a tireless leader and advocate for First Nations, and I know I am joined by people across the country in recognizing and celebrating his years of devoted service to First Nations communities. We lift you up, Perry. We will continue to work with the National Chief to advance the priorities identified by First Nations, including keeping First Nations communities safe from this pandemic. Finalement, j'aimerais conclure en félicitant Michael Sabia pour son nouveau rôle de sous-ministre des Finances. Il fait un travail remarquable en tant que président de la Banque d'infrastructure et je sais que ses compétences nous seront très précieuses pendant que nous rebâtissons une économie forte et résiliente. C'est Paul Rochon qui occupait le poste de sous-ministre des Finances depuis 2014 et j'aimerais également le remercier pour toutes ces années de dévouement et son travail exceptionnel pendant cette pandémie. Merci à tous. Anita.
Thank you, Prime Minister, and thank you also for mentioning the important report on the Royal Commission on the Status of Women, such an important milestone for us to remember. Depuis le début de cette pandémie, mon ministère des Services publics et Approvisionnement Canada et moi-même avons travaillé sans relâche pour veiller à ce que les travailleurs de la santé de première ligne au Canada disposent de l'équipement protection individuelle indispensable pour faire leur travail. Les provinces et les territoires ont accès aux fournitures de tests et aux kits de tests rapides dont ils ont besoin. Tous les Canadiens ont accès à des vaccins sûrs et efficaces. From the outset of this pandemic, my Department of Public Services and Procurement Canada has worked tirelessly to ensure that Canadian frontline healthcare workers have the vital PPE necessary to do their jobs. The provinces and territories have access to the testing supplies and rapid test kits that they require, and that all Canadians have access to safe and effective vaccines. We have ensured that Canadians have access to the supplies and vaccines needed in a hyper-competitive global marketplace marked by uncertainty, volatile supply chains, and shortages of raw materials. It is because of this reality that we continue to pursue an aggressive procurement strategy with a diverse portfolio of suppliers, whether in the area of PPE or vaccines. On PPE, we have procured more than 2.5 billion items of PPE. We've received more than 1.25 billion articles of PPE to date. To be clear, this inventory includes Canada's complete order of more than 20 million liters of hand sanitizer, 90% of the face shields and gowns that we have ordered, and more than 84 million N95 respirators. Millions of made in Canada N95s will continue to arrive for at least a decade. Our unrelenting approach to procurement is also why deliveries of vaccine doses will begin this year instead of next, pending regulatory approval. With up to 249,000 Pfizer doses coming this month, we are ensuring that Canada is well placed to undertake the largest mass vaccination operation in Canadian history. Thank you also to Général Fortin for joining our team in this regard. Throughout 2021, I want to assure you that millions and millions of vaccines will continually flow into this country once they are approved by Health Canada. That has been our procurement strategy from day one. L'annonce d'aujourd'hui nous donne l'assurance qu'il y a de la lumière au bout du tunnel, mais nous avons encore du travail à faire pour nous assurer que ces vaccins et fournitures connexes continuent d'être livrés et administrés. Our goal continues to be to ensure that Canada has the vaccines, logistics systems, and supplies in place to further combat COVID-19. And we will not rest until we climb this mountain. Merci beaucoup. Megwetch, thank you so much.
Thank you, Minister. We'll now turn to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Dylan Robertson, Winnipeg Free Press. Line open.
Good morning, Prime Minister. Are you intending to divvy up the initial Pfizer doses on a per capita basis to provinces? And is there going to be a separate quota for First Nations on reserve for any other Indigenous group?
The NACI, the Immunization and Vaccination Advisory Board, filled with scientists and experts, have made determinations around the most vulnerable populations that need to receive vaccinations in a priority basis, and that is guiding our efforts and our decisions on rolling out vaccines. We recognize the challenges around logistics of the Pfizer vaccine. I've been working closely with Northern premiers and Indigenous groups. We've identified 14 sites across the country where we will be able to immediately start delivering those Pfizer doses because they require 80 below temperatures. So it is not easy to roll them out to more remote locations, but this process will allow us to stand up our processes for delivering and handling this first vaccine as quickly as possible. There will be more doses of other vaccines at later dates on a priority basis for Indigenous peoples, particularly those who are northern and remote. Okay. Nous avons identifié 14 lieux de distribution de vaccins pour le présent, pour le vaccin Pfizer. C'est tout dans des grands centres urbains, mais ça va être distribué selon les priorités établies par le panel d'experts sur l'immunisation avec les groupes prioritaires en tête de liste. Mais nous allons continuer de travailler avec les fournisseurs de vaccins et les communautés autochtones et les premiers ministres des territoires de l'Arctique pour pouvoir livrer ce dont ils ont besoin le plus rapidement possible.
Follow-up, Dylan?
And Prime Minister, Manitoba has the highest proportion of Indigenous people, and Premier Brian Pallister said that if you give the vaccine to provinces on a proportionate basis, but then make them prioritize Indigenous people, that all other Manitobans would be waiting the longest out of all Canadians for a vaccine. To you, is that a racist comment?
Our work is to make sure that all Canadians get vaccines as quickly as possible. And with the contracts we've signed, with the news we're announcing today, we're well on our way to do that. In terms of distribution, I think all of us understand that getting vaccines first to the most vulnerable people is exactly what we need to do, and that's what we're focused on.
Next question, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau. Dans vos remarques d'ouverture, vous dites que la livraison des vaccins sera conditionnelle à l'approbation du vaccin, mais les règles avaient été changées pour permettre la livraison avant l'approbation. Donc, je me demandais, est-ce que ça a changé?
On travaille très proche avec la compagnie Pfizer, évidemment avec un vaccin qui doit être entreposé à moins 80 degrés. Ils veulent s'assurer qu'on pourrait les livrer aux Canadiens directement le plus rapidement possible dès qu'ils arrivent. C'est pourquoi on a beaucoup d'espoir que Santé Canada, selon leur indication, pourrait approuver le vaccin Pfizer cette semaine, et donc on pourrait commencer à livrer la semaine prochaine. Mais pour le processus d'approbation, Howard, as-tu un peu plus là-dessus?
Non, nos collègues de Santé Canada travaillent très fort, c'est sûr. Il faut mentionner que notre système réglementaire est un des meilleurs du monde. Et c'est pour une raison, pour assurer les Canadiens que n'importe quel vaccin de COVID-19, si c'est approuvé, c'est vraiment sûr et efficace. Et on attend une décision de Santé Canada bientôt.
Suivi, Catherine?
Oui, absolument. Donc, vous n'êtes pas capable de me dire si le processus d'approbation a changé, mais et puis en termes de chiffres, donc 250 000 environ doses, est-ce que ça veut dire qu'il y aura nécessairement 150 000 personnes vaccinées au Canada d'ici la fin de l'année?
Nous attendons avoir 249 000 doses d'ici la fin de décembre au Canada et c'est des vaccins à 2 doses. Donc, effectivement, ça veut dire qu'on va commencer à vacciner le plus de gens possible dans les groupes vulnérables.
Thank you. Operator, next question.
Thank you. Merci. Next question, Steve Shear, Reuters. Line open.
Hello, Prime Minister. I wanted to go back and ask a little bit about what Dylan Robertson was asking about before. Can you confirm that First Nations isolated communities in the north will have priority access to vaccines, say, before than the general public in places like Ottawa?
We have worked very closely with the premiers in the Northern Territories as well as Indigenous leaders across the country. We know that they are a priority population and therefore will be part of those initial 3 million doses we're expecting in the beginning of 2021. Those are expected to be a combination of Pfizer and Moderna doses. The Pfizer vaccine, because it is required to be stored at 80 below, has more significant logistical challenges, which is why we are setting up initially 14 distribution centers in large urban areas, but they will be added with more over the coming weeks. Perhaps Major General Fortin can speak to the logistical distribution, including as we get out to further areas.
Merci, Monsieur le Premier Ministre. I would simply add that the territories have indicated a preference to other vaccine candidates because of the complexity associated with distributing the Pfizer vaccine. So we're very much paying attention to the priorities and making those vaccines available as rapidly as possible once they're approved. In terms of distribution of the Pfizer vaccine, as mentioned earlier, the 14 sites are to be ready by next week. Preparations are well underway. Once we're comfortable with that process, we'll expand deliberately into other areas in close coordination with provinces and territories. Certainement. En français, je pourrais vous ajouter que les territoires, on est en étroite collaboration avec les territoires, les Premières Nations. Et puis, ils ont indiqué une préférence pour un produit qui est un peu plus facile à manipuler, d'autres vaccins. Alors, on est en train de se concentrer sur la distribution des prochains vaccins et en étroite collaboration avec les territoires et les Premières Nations. Même chose avec les provinces pour les régions plus éloignées. Maintenant, pour ce qui est de la distribution de Pfizer, on a mentionné la semaine dernière, d'ailleurs, 14 sites près de la semaine prochaine. On est en train de travailler sur leur état de préparation ensemble avec les provinces. Et puis, tout est en ligne pour pouvoir commencer lorsqu'on aura la permission, que le vaccin soit homologué. Et puis, à partir de ces 14, on pourra élargir le nombre en étroite collaboration avec les provinces à mesure qu'on est satisfait avec notre état de préparation.
A follow-up, Steve?
Yes, Prime Minister. Last week you had said that there would be further guidance as to what the priority groups would be, so the people who would first be getting the vaccine. And I guess my question is, will the provinces then be expected to follow those guidelines in the same way that essentially the federal government sets them? So do you expect the provinces to then follow the federal guidelines when they implement the vaccinations?
We've set out through the recommendations of the expert group on vaccine prioritizations, clear guidelines, and it'll be to the provinces to adjust and implement them in a way that is suitable for their populations.
Thank you.
De Radio-Canada. Juste pour comprendre, là, vous dites que les premières doses pourraient arriver la semaine prochaine, mais concrètement, quand est-ce que les premiers Canadiens pourraient être vaccinés? En fait, c'est quoi le délai là, entre la livraison et la vaccination?
La livraison des doses et la vaccination, ça se passera extrêmement rapidement. Donc, les premiers Canadiens vont se faire vacciner la semaine prochaine si on a l'approbation de Santé Canada cette semaine. Danny, sur le temps entre livraison et Howard?
Monsieur le Premier ministre, je pense que ce qu'on m'a indiqué, c'est que c'est relativement rapide, un jour ou deux, pour passer à travers les étapes de manutention, déballage, dégeler le produit, et puis décanter, et puis le mixage. Alors, ça a l'air un peu complexe, mais c'est relativement court pour les professionnels de la santé. Certainly, and so far I'm okay. Yes, I would simply say that it's a matter of a day or two, is my understanding, based on the fact that once you receive the product, you have to unpack, thaw, decant, mix. So that's a relatively fast process for the health professionals.
Dr. New, you would just add the point that when you look at the actual vaccination of Canadians, it's a very close, obviously, integration between the public health aspects and the logistical aspects. So as Major General Fortin pointed out, you know, the delivery, then the decanting and all the mixing and so on, all those technical details has to also then line up with what, from a public health perspective, is the practical aspects in terms of looking at the priority populations that need to be vaccinated, and depending on the number of doses and when they come, how that's actually going to be operationalized in terms of actually, as you say, getting the doses into people. The other point also that we're looking at from a public health perspective is that, you know, not all the doses are going to arrive all at one time. It's going to be sort of a regular stream. And so that's part of the planning process in terms of public health priority populations. You know, what's also practical, what can we do in the early days, and maybe it might be a focus on urban centers or places where it's more, I think, amenable to having those vaccinations take place. And then as we get more and more doses, we'll be able to offer it to more and more Canadians. Thank you.
Minister Anand?
Thank you, Prime Minister. I just want to bring it back to our contract with Pfizer. There are a number of stages that need to be walked through before the deliveries occur. So, of course, I want to stress the importance of approval from our independent regulator at Health Canada. After that, there is the window, of course, for shipments to occur. But before those shipments occur, Pfizer needs to be assured that the provinces and territories are ready, in fact, to receive those doses. And it's important to know that that's the work that Major General Danny Fortin is doing with the Public Health Agency of Canada in conjunction with the provinces and territories. Once we are assured of provincial and territorial readiness to receive, then we will be able to pass the baton to the provinces and territories. So the last kilometer, in fact, is with the provincial and territorial jurisdictions, and we will carry the baton as far as we can along that line. Thank you.
I'm McGregor, CTV News. Prime Minister, a few weeks ago, you came out and said that Canadians are going to have to be prepared to watch citizens in other countries get the vaccine first. Then, I think it was last week, you said it didn't matter when we get to the start line, what matters when we get to the finish line. Now, today, you're kind of pulling a rabbit out of the hat and saying, hey, we're going to have vaccines in December. Did you instruct Minister Anand to go out and negotiate this deal to get a comparatively small number of vaccine doses because you were concerned about the political optics of seeing other countries getting vaccinated first?
We've been working on signing contracts that are flexible enough to get us the earliest possible doses of vaccines since this past summer. This was always an intention that we had, to try and get vaccines to Canadians as quickly as possible, along with our imperative of securing the largest number of doses for Canadians possible from the largest range of potential vaccine producers. When we made a commitment to Canadians that we were going to do everything we could to give them the support and the path through this, we were serious about that. We know that there is a tremendous amount of uncertainty in terms of which vaccines were going to arrive first, which ones were going to be able to be manufactured quickly. These were always built into our process as possibilities. But until we were able to sit down here today and announce firm delivery pending the final approval by Health Canada, we wanted not to get people's hopes up. Because this is something that Canadians have been looking forward to for a long time, getting to these vaccines and getting beyond that. I will say from a logistical and delivery standpoint, this is the largest mobilization of vaccines in Canada's history, and being able to start with a smaller number and rapidly scale up as the flow of vaccine doses starts increasing quite rapidly, this is a good thing to allow the folks on the ground to be able to deliver certainly this Pfizer vaccine, which has a high degree of complexity in the delivery. Ça fait depuis cet été que la ministre Anand et d'autres négocient avec des compagnies de vaccins pour pouvoir avoir le plus de vaccins le plus rapidement possible pour les Canadiens. On a déjà parlé du fait qu'on a sécurisé plus de doses potentielles par personne que n'importe quel autre pays dans le monde. On a aussi souligné qu'on a une meilleure gamme de différentes compagnies de production de vaccins pour s'assurer que ceux qui seront le plus efficaces ou le plus rapides arriveront au Canada. Mais on a aussi travaillé avec ces compagnies de vaccins pour assurer que le Canada puisse en recevoir le plus rapidement possible. Je sais que c'est quelque chose que les Canadiens attendaient avec impatience et donc je suis très content de pouvoir l'annoncer aujourd'hui parce qu'on a enfin un grand degré de certitude que ça va fonctionner pour la semaine prochaine. Évidemment, on parle d'une mobilisation extrêmement complexe, donc c'est une bonne chose qu'on commence avec moins de doses pour pouvoir être prêt à vacciner le plus de gens le plus rapidement possible une fois que les doses commencent à arriver par les dizaines de milliers et même les centaines de milliers par semaine.
Prime Minister Lee Berthiaume, Canadian Press. You say we're getting 249,000 doses by the end of the month. Can you spell out in as much detail as possible who are going to get those doses?
The contract we've recently amended with Pfizer allows for them or they engage to deliver up to 249,000 doses to Canada before the end of December. In terms of distribution, next week's distribution will happen through 14 different sites that have been identified across the country, one in each province and 2 in our 4 largest provinces. This is to be able to initially get doses out to the most vulnerable people, but also to demonstrate and to operationalize what is going to be an incredibly complex mobilization of vaccines across the country. It is a gradual process that is going to begin this coming week, next week. But let us remember, at the beginning, there will be smaller amounts of vaccines because we are both standing up our delivery mechanisms, but also because manufacturers are limited in what they are able to produce for this vaccine. The large mass manufacturings will be happening into 2021, but with these 249,000 doses coming in December, we will be able to begin on the most vulnerable populations and make sure that we have the logistical grounding and foundation in place to be able to deliver right across the country over the first months of 2021. Any further additions to that? Anita?
I would just add to those very accurate remarks that we are utilizing our negotiating position, a very strong position with vaccine suppliers. Each and every day, we are in touch with these suppliers in order to ensure that Canadians are in the best possible stead. So in those negotiations, we are continuing to press for the earliest possible delivery dates once Health Canada approval has been obtained. And that is why we were able to secure the agreement with Pfizer announced today. And that is why we will continue to work with our suppliers for the earliest possible delivery dates for Canadians. Thank you.
I would like to just clarify your answers previously to my other colleagues before I ask. Is it per capita then for this first 250,000 doses, or is it based on a province's share of it, the most vulnerable people you want to target, or is it based on the province's readiness to receive vaccines? And if it's based on readiness to receive vaccines, can you talk a bit about what are the conditions that you need to see in those provinces? Because if things go wrong, who's then liable? Have you allowed the companies to waive liability, for example? Are you wearing the liability? Could you speak a bit about that, please?
The decision on distribution to provinces and territories, it was agreed, is going to be done on a per capita basis. For the further complexities, I will turn to the doctor and the Major General. Dr. New.
Okay, maybe I'll start. So yes, we've been having active discussions, with our public health counterparts in the provinces and territories for quite some time, and they're ongoing. So as I mentioned earlier, we have received the advice from the National Advisory Committee on Immunization, and so everyone's aware of the 4 priority groups, Indigenous communities, healthcare workers, older Canadians greater than 80 years of age starting off, and then moving down to younger Canadians, and then, of course, individuals in long-term care facilities. But as we receive the vaccines, the other consideration we're discussing, and Major General Fortin can speak to it, are the logistical aspects as well as the epidemiology in each of the provinces and territories. Every province and territory might have a slightly different experience, and so how they receive the vaccines and prioritize and actually deliver those initial doses to their populations, I think certainly will be based on their own experience and what they determine is best for their individual context. I think I'll leave it at that and pass it on to Major General Fortin. Liability.
I'll turn to Minister for that.
You can call me doctor. Listen, I think we have to be very clear that every Canadian who wants access to a vaccine is going to have access to a vaccine, and that vaccine is actually provided free of charge from the federal government. In terms of liability issues, it's really important to remember that in our contracts, we specifically implemented clauses that ensured that the vaccines would not be distributed unless they were approved by our gold standard regulator at Health Canada. And that has been the very important point that I continue to mention, perhaps ad nauseum, because it is the way in which we as a country here proceed based on science, based on the best advice of the scientists before we have this rollout. And so in terms of liability, we are able to hedge, therefore, that liability by relying on the excellent judgment of the scientists at Health Canada.
Merci, Monsieur le Premier Ministre. In terms of logistics, we're in daily coordination with provinces and territories, and with the 14 initial sites, we're closely monitoring their level of readiness. We have agreed on the condition criteria with the provinces. The provinces are really on track to have all those sites ready. We're exercising a dry run this week. Boxes are in the air right now. They left Belgium and they're on their way to the next transit node in the cold chain. They're being monitored. So we will learn. This is one way this week where we will learn how the process will flow if adjustments need to be made. Pfizer will learn just as much as we will because they will make some necessary adjustments. Next week, as indicated earlier, 14 sites ready. We're confident at all levels that we're going to get there with some adjustments as we go over the course of the week and next week, no doubt. But we're confident that we're in a good position to start. We have a good visibility on those conditions, and the training is underway starting tomorrow. And then from there, we'll expand in terms of numbers and expand at scale.
On the question of liability, I think the most important thing to remember is these vaccines don't get approved unless they are safe for Canadians. Health Canada has one of the most rigorous approval processes in the world, and we are deeply watching other countries go through their processes, but we will make our internal, Health Canada will make its own internal process decisions based on what is safe for Canadians. And if Health Canada approves these vaccines, then we will begin to deliver these safe vaccines to Canadians across the country. In regards to the contract signed, there was questions of liability, and Canada has undertaken the necessary measures to ensure that everyone is protected through that. Oui. La décision a été prise par le comité d'experts et le gouvernement que la distribution de vaccins sera faite per capita à travers le pays pour chaque province. Les provinces, eux, vont fonctionner à l'intérieur du cadre qui a été établi par rapport aux populations prioritaires. Mais il faut se souvenir aussi qu'on n'est qu'au tout début d'un processus de distribution qui va voir des millions de vaccins distribués aux Canadiens dans les mois à venir. Et l'apprentissage de comment bien gérer cette vaccination pour qu'on puisse justement vacciner des millions de personnes par mois, éventuellement peut-être par semaine, ça va être extrêmement important. Donc, c'est une bonne nouvelle qu'on commence maintenant, mais la bonne nouvelle, c'est réellement que c'est un début qui va nous permettre de commencer graduellement pour pouvoir, en fin de compte, avoir le plus de Canadiens de façon la plus efficace et la plus sûre possible dans les mois à venir.
Ashley Burke, CBC News. Good morning. Can you just clarify, out of the 249,000, will that be 249,000 people who receive the vaccine, or will that be about half that amount of people who get the shot but they'll get 2 doses? And my question is, I understand the government has a diverse portfolio when it comes to vaccines. There has been more option for Moderna, knowing that it might be easier to transport around the country, especially to remote communities or northern communities. Moderna's never created a vaccine before. It's never scaled up to this size before. How much confidence do you have in Moderna to do that?
First of all, we will continue to work with all vaccine manufacturers on their delivering of supplies. Yes, there is significant unknowns in terms of manufacturing capacity for various vaccines. They have never been made at this scale before, at this speed before. That's why, first of all, the regulatory process needs to be as rigorous as it always is. There are no corners cut by Health Canada in terms of approving a vaccine for safe use by Canadians. On top of that, we know that in building a new vaccine, there would be challenges that certain companies would encounter that others might find an easier time with, which was why we set out to build the most diverse portfolio of vaccines in the world, and we ensured more than enough doses for Canadians through all those different vaccine contracts to make sure that if one company does face greater logistical or manufacturing or health approval challenges than others, we have others that will ensure, other contracts that will ensure that Canadians stand the best chance possible of getting vaccinated and getting through this COVID-19 pandemic as quickly as possible. The Pfizer vaccine is a 2-dose vaccine with a few weeks apart. Part of the challenge of the logistical delivery is to see whether those doses can be properly stored and delivered a few weeks later to the same people. That's what Pfizer as a company is looking for. You can imagine that any responsible company like Pfizer is going to want to make sure that none of their vaccines are going to be wasted through inability to properly store, transport, or administer. Every single dose of those vaccines are extraordinarily precious right now. So they will be looking very, very closely at our ability to do that. So those 249,000 doses to be delivered in December, the vast majority of them, if not all of them, will be 2 doses for a single individual.
Thank you, and that concludes today's press conference.
Merci beaucoup tout le monde.